So tell us what you've been doing as a peer educator.
I've been going into the class below.
What I might get you to do is pull the microphone a little bit up there so that it's a bit closer to you, because we'll get it there. Just a little higher.
Hold it.
Right, harder.
Is that better?
Yeah, it's a bit better,
okay.
Thanks.
What I've been doing is going into the class below me, which is Year 9, and running a weekly sex ed workshop with them. And it runs for about 45 minutes, and I've just been doing some activities and kind of answering their questions and getting to know what they want to learn about, so I can structure the workshops to teach them.
So what are you finding when you do that?
I'm finding that they're really engaging, and they have told me that they appreciate that I'm not talking at them, and that they really like the peer education because it's much more relatable than if an adult is teaching them. So,
do you have a sense of what they want to know?
I think they just want information that comes from someone who is experiencing the same things and discovering the same things that they are. So I think that it's a really good way to get the safe sex message across to them.
So give me a sense, I mean, can you tell me about the most difficult conversation you've had?
Yeah, the people have been really respectful in my workshops and haven't been that difficult. But the hardest thing for me to deal with is when I talk to people that I know have had a really good sexual education, and then they don't use their knowledge to be safe, and they continually kind of don't appreciate the knowledge they've been given and use it. So it's very frustrating when you know that not everyone gets a good sexual education, and then the people that have one aren't respectful of what they've learned. So.
Have you ever felt, I mean, some people say about peer education that one of the important things is to be supported yourself, because you could be thrown into circumstances which make you feel vulnerable or at risk. I mean, as somebody who's the same age as the people you're talking to, do you ever feel that way?
No, I think that I've felt always really supported by Year and the program that I've done, and I've always been able to ask questions and always gotten help when I've needed it, and the young people who I've been teaching are also very supportive and helpful if I need them to give me feedback or something. So,
Sam, you mean one of your jobs is to provide that kind of support?
Yeah, definitely.
Is that on?
Yeah, so if any of our agents from the Melbourne crew have issues or want help in dealing with things, I'm there to provide that to them, and I hope that I can do that in the best way possible with the assistance of other people from because it's all really laid out there. We've got the resources and the materials to kind of help young people positively in the way that we want to.
In the way that you want to. Doesn't that contradict what Una was saying, and others are saying, which is finding out what people want to know and then giving it to them?
Yes, in some ways. Such a loaded question. In the way that they want to, or in the way that we want to, I feel like that's based on my own experience, my experience as a young person, and not wanting to have education fed to me in a way, or like messages around sexual health fed to me in things that are like a biology lesson, which is the sex ed that I received, but fed to me in a digestible way, which is easy to relate to and kind of just grasp.
Now, people, the assumption, Alicia was talking about, everybody wants to talk about sex, but that's not necessarily true, is it?
No. Yes and no. I mean, there's a lot of sexual shame, people... Sexual shame. Sex is a tricky thing to talk about, and it's much easier when you're talking about it with somebody who has the same experience as you, is on the same level as you, and not someone who might be a bit older and might be talking down to you and dictating these messages. So that's why peer education provides a great platform, because it is based on, you know, our experiences as young peer educators.
How do you know you're having an effect? What does success look like?
Ooh, that's such a hard question. I'm not sure, really. I mean, you could...
Well, in your own mind rather than anything else.
Success for me is, you know, somebody being quite engaged with what I'm saying, and challenging moments that I face is that you always come across a group of like little brats in the corner that just want to make fun of what you're doing, and you just really want to send them out of the room. But that's not what it's about. It's about making kind of light of the situation and talking about it in a way that's relatable to them, so those messages that you've got to deliver come through. So success for me is delivering that message.
Or finding another brat to deal with the brats, if you're going to deal with peer education.
Yeah.
I mean, Kaushi, you've obviously come up through this and have experienced the peer educator as well as coordinating the volunteers. Tell me about the sort of, I mean, that question I put to Una, which is a serious issue, which is about supporting the people who are doing the work.
Yeah.
Well, how big an issue is that? Am I making a bigger deal of that than is worth making? Or?
Oh, not at all. I definitely believe that it's my job to support, but in some senses it's quite easy, because after Una or somebody else teaches a workshop, then I usually have the chance to sit down with them and talk to them about their experiences. And I always get feedback on whether the resource is working, what more can be done, and that helps me create more resources and be a better person when it comes to support in general. So it's quite a circular process.
What do you tell peer educators? What's the training that they get? Because you could be in a situation where a young person discloses something about themselves which they've never done to anybody else, about their sexuality or maybe even about abuse, which is really a very difficult situation and something that you've got to kind of feel confident to deal with.
Definitely. As a manager of these peer educators, I feel like a counselor, a sister, a mom, a friend. It's about playing all those roles and being ready for someone to talk to you about something really serious, and just having no judgment at all, and just being open to the fact that they might come out to you about their gender, about their HIV status, and being ready to just say, thank you for saying that to me, and I will take that into consideration when I'm asking you something as well.
Chris Castle, give us a global perspective of this important enterprise. I mean, increasingly in other sectors such as mental health, it's recognized that peer support can make even sometimes a much bigger difference than a trained psychologist or psychiatrist. But here in sexual health, just give us a global picture of what's going on and put this into perspective.
Sure, thank you, Norman. And can I start also just by thanking Ye for the opportunity to be associated with such a terrific event and excellent program. I wish we had more programs like this all over the world, but unfortunately, these kinds of programs are all too rare. One of the things that we see around the world is that for various reasons, particularly in low and middle income countries that are poor, it's not easy for young people to come together and have the kinds of programs that we see here through the example of Ye. And so they rely on school-based programs, primarily those which are delivered in classrooms. And these kinds of programs that we're talking about this evening are excellent opportunities to complement and reinforce school-based programs. And I know that's very much a part of the Ye approach. Because let's be honest, we know that sometimes in classrooms, teachers themselves don't feel that they've had the kind of training or confidence that they need to be able to discuss these topics with their learners or their students. And so it's really quite variable. I will say the one thing that we're very excited about from our perspective at UNESCO and as a UNAIDS co-sponsor is that countries increasingly are recognizing that we've got to do things differently. As Alicia was saying earlier, it's not okay just to continue with business as usual. It's very sobering at this AIDS conference that we are noting that young people bear a very high level of burden for HIV infections, but it's more than that. It's also about unintended pregnancy, early unintended pregnancy, which is really very problematic and difficult for the health of young women. And young people need the tools, the knowledge, and the skills in order to make changes and choices for healthier lives. And so I think more and more countries are starting to recognize that. It is a little bit of a sensitive issue, and unfortunately in many countries, this idea of young people themselves stepping up and speaking to each other in a way that we're seeing from the peer educators here is not necessarily a widespread model, but we'd really love to see more of it.
So what role, if any, or are we being overambitious about peer education, do peer educators have in a more community development aspect? Because it's been shown in many studies that it's a supportive environment that allows young people to develop the way they want to, a caring environment that might set boundaries, or do peer educators, do we not get too ambitious for peer educators that they just do what they do and not worry about that broader supportive environment?
Well, I mean, I think we heard from some of the examples from the peer educators already that I think Una said that one of the frustrating things is that even with knowledge, young people still don't always take the precautions or make the choices that they know they should do in order to reduce their risk and vulnerability to HIV and to unintended pregnancy. Why is that? And one of the reasons is because maybe they don't have the right social norms. Young women in many countries don't always have the opportunities to refuse or to negotiate unwanted sex. Unfortunately, there are situations where there's coerced or forced sex or gender-based violence. These are really serious issues. School-related gender-based violence. We believe at UNESCO that schools should be places of safety, safe learning environments for young people, but unfortunately, sometimes schools as well are not always the safe learning environments that they should be. And so peer education programs like this are really important and excellent because it also means that these young people are empowered themselves to take action to change the social norms that will allow them to say, it's not okay. If I don't want to start my sexual life, I'm not ready to do so, I don't have to. And if I choose to, I can do so in a safe way because I have the knowledge and I have access to the commodities, the services, and everything that I need in order to do so in a safe way.
So Una, do you feel that you're giving your peers that sort of confidence?
I hope so. It's a really difficult issue because consent is something that that I found when I was teaching, that a lot of people thought if they'd given it then they couldn't retract it, especially a lot of the girls.
In other words, you've crossed the threshold because at one moment in time, for whatever reason, you've said yes.
Yeah, and then that once you're in the moment and it's happening, that you can't retract and take your consent back, like that it will ruin the moment or that the person won't like you anymore. And it's a big thing that a lot of the girls that were talking to me about, that they didn't think they'd have the confidence to talk to their partner or about saying that they actually weren't ready or that they didn't want to, which is the same thing about stopping and putting on a condom or something. They said that, oh, but how do we say that if, it's hard for them. I think that I found to find the confidence to speak up. So I think that what I've been trying to do is, I guess, do some activities and stuff and teaching them about how they can phrase things and so how they can gain the confidence to be able to retract their consent if they want to. So, yeah.
And Luiz, your perspective on this from the international perspective and also particularly from AIDS prevention? You might need that microphone a little bit closer. Yeah. I hear you were honoured today, by the way, by getting a protest in your presentation.
Yes. Actually,
what did you do to...
Let me give you first my personal perspective. You know what? I have been since Saturday here, and I was in several very meaningful events. I was in an event with the main faith-based leaders that are in Melbourne for this conference. I was in a meeting this afternoon where the Speaker of the Australian Parliament did a great speech, Madam Bishop, and many other parliamentarians. I was in a dinner with Justice Michael Kirby and Koch. Several very significant events so far. And I had the protest in my session that was the biggest protest so far in this conference. And that's something good, because the activism has been key to bring us this far. And it happened just in my session. It was very welcome. But actually to be here today, to me, is what I was looking for, came to Australia. You spoke about the end of AIDS when we introduced this issue. There is no question that we have on sight the end of this epidemic for the first time. But the major blockage that we have now, we had published this, called the Gap Report. That's basically a summary of what's holding us back. But actually, the biggest gap, the biggest block on the road to the end is the generation gap. Between the generation that saw this epidemic in a time that there was no hope, that was my generation, some that come after, and the generation that's coming now. The main challenge to deal with AIDS today is the increase of the epidemic among young people. AIDS today is highly selective when it comes to age. The epidemic is increasing everywhere, independent of the kind of population among young kids. This is the epidemic, this is the challenge. But the problem is I think we are not find a way through, to get the message right. Cannot be, because you guys did not see what I saw, that you are going to get infected, that you are going to die because you didn't see people die in the 80s, in the 90s. Cannot be. We cannot depend on people dying, on people suffering, to put a message through that you cannot get infected. We need to find a way. But the main point, Alan, that I think is we are not getting through because we don't have the ways to. It's not my generation telling the story to your generation that we're making this message through. You need to take this forward, find your own way, and go forward and make it happen. What we are doing here, your peer education, to me means survival, means less infection, means bringing this epidemic down. It's as simple as that. You are right in the center of what we need to go from here to the end of AIDS.
I'm conscious that I'm standing between you and the bar at this point in the evening, and I think that's a very good place to end this discussion. Could you please thank our panelists?